Most likely, unless the 450 hours is changed, which the sense I get is that that's something that we feel really strongly about. You would have to find a situation where you could be supervised and gain those hours. You would only be prevented from practicing controlled active psychotherapy, which is working with clients who have serious disorders, treating clients who have serious disorders, if you were supervised, shall we say, by somebody who is authorized to do controlled active psychotherapy. I believe you would be covered. But those are some of the fine details that we haven't worked out yet. But our registration regulation is still in draft form, and all of those numbers may change. But I think what you're going to find is you're going to have to find a way of getting those hours together before you'll be eligible for registration. You could register or you could attempt to register as a registered mental health therapist initially, if you met the requirements for that category. And then actually you would be authorized to use or practice within the controlled active psychotherapy. All members of our college will be able to do that. And you could then pursue those additional hours in order to qualify for registration. The other thing that we anticipate is that the programs that we've already been approached by, a couple of the education programs will change their program requirements in order that their graduates will meet the requirements for registration. And that will be a bit of an evolution.
I have a question for Catherine. My end goal is to become registered as a clinical and forensic psychologist. So in choosing my practical placements right now, I know you said you have no requirement of direct client contact hours.
Well, it's not that there's zero, but we just don't specify them. So it has to be a substantial amount of contact, but it's not a specific number.
Okay, and I'm wondering in regards to assessment hours, so like psychodiagnostic, personality assessments, cognitive assessments, psychoed assessments, is there information in regards to how many of these you should have been completed? Should you be exposed to every different type of assessment? Like, what are the specifications around that?
Well, it's good to have some breadth of training, but and in your practicum, you're really getting the basics, the fundamentals of assessment. Once you get into the internship, if it's possible to get a pre-doctoral internship in a setting that would prepare you for either clinical psychology work or correctional psychology work, that would help. And when you do your postdoctoral supervision, it's even more important that you get exposure to, particularly if you want to go into clinical and forensic psychology, rather not correctional, but forensic psychology, that your postdoctoral year you get that kind of assessment experience on a consistent basis. And sometimes if you can't get both types of assessment experience in one particular setting, which would be preferred, what you may be able to do is have your primary supervisor oversee one type of assessment training and your alternate supervisor oversee another type of assessment training that you might be able to pick up in some additional part-time work. But the more that you can get that exposure, particularly in the internship and postdoctoral supervised year, the better. In the practicum, it's pretty hard to distribute your experience. And the program will certainly ensure that you get a good foundation in the general principles of assessment. But once you get into the internship, in particular the postdoctoral year, then you should really try to focus on getting work in settings that will give you the specific assessment experience.
I'll just add to that. Generally speaking, if you graduate from an accredited program, it should prepare you for licensure in any jurisdiction. So, and there will be, the Canadian Psychological Association accreditation criteria are fairly prescriptive in terms of how much assessment and what kinds of courses and what kinds of intervention courses. And but I mean, there are exceptions, but generally it should prepare you for that. But the other thing to point out, of course, your registration anywhere in Canada is as a psychologist, not a clinical psychologist or a forensic.
Yeah,
like
however,
the title is,
however,
but you declare your
fairness,
yes.
It's
yes.
the title is psychologist, but in fairness, at least 3 jurisdictions will look at your intended area of practice. whether it's clinical psychology or
Yeah.
forensics or whatever, and we'll want to be sure that you're actually competent to practice in that particular area. Even though the title psychologist, you will in Ontario at least be permitted to describe yourself as a clinical psychologist or forensic psychologist, or say practice in clinical psychology or forensic psychology, even though we don't have specialty designation. We do look at areas of practice and areas of competence.
I'm the back there.
I think this is a question for the CPO. Is there a way that we can kind of check to make sure we have the foundation core courses, like have someone kind of verify that if we have any concerns before we're actually in the registration
We
process?
actually don't do sort of pre-approval or pre-review, but we will walk through our registration guidelines and explain them to you. So if you want to discuss, those in detail, we'll walk you through them. But we won't do a pre-application review and say, yep, you've got it, or no, you don't, unfortunately. But certainly for the foundational courses, have a look at the website. You'll see that under each of the 4 areas for foundational knowledge, there's several different courses that you could take, and the coverage is for the equivalent of, in 2 of the areas that you have a full year course in each of 2 areas, or 2 half-year courses in each of 2 areas, plus a half course in each of the other 2 areas. So it's not onerous, but it's still important, and so there is a list in the guidelines to give you a sense of what courses fit under what.
And what qualifies? I think there's something like senior level or upper level undergraduate.
Anything
courses.
except an introductory course. So it doesn't
Okay.
matter whether it's 3rd year or 4th year. We'll even take 2nd year undergrad as long as it's not an introductory survey type of course.
Okay.
In the pink.
This is a question for Joyce. So it's related to the client hours question. 450 hours of direct client contact hours. Any sense of whether or not they would need to be supervised hours? And if so, what would the scope of the supervision look like?
Well, there's also a requirement for a certain number of supervision hours that are related to the client contact hours. I think the number is 150 actually. So your question is really what would the supervision look like, and who could be an approved supervisor, which is a very good question, and the council has not really grappled with that issue yet, except we do we know that it's an issue out there, and it's something that we're going to have to look at and address. And we've had a couple of written submissions actually recently on this question. There are some who would like to see a special category of membership within the college, or a specialty for supervisors. There's no thought to doing that anytime soon, shall we say. We have to deal with the first things first, the 2 prescribed members of or categories of registration in the legislation. Another question actually that comes up around supervision, which is a good question, and we don't have an answer to it yet, but will supervisors have to be members of our college, which may be problematic initially for obvious reasons, right? So the question is, will other members of other professions, regulated professions, who have access to the controlled active psychotherapy, will our members or future applicants, let's say, be able to be supervised by some of those professionals? We don't have an answer yet to that question, but I think the feeling is, or thinking is, that probably the answer will be yes, because it would certainly ease the situation, for one thing, in terms of making supervisors available. But there's also a whole movement within the regulated professionals and through the Ministry of Health to promote interprofessional collaboration and to break down some of these silos of professionals and to have them working together collaboratively and to some extent synchronizing their standards. So I mean, my expectation is that will probably happen, but I don't know that yet. There's quite a lot of work left to be done on the whole supervision question.
Anyone else? There were some on the couch there somewhere.
You asked my question, so thank you.
Okay, oh, go ahead.
Sorry, I have one more question. This is for Catherine. I was originally, when you go onto the website and look at the requirements, it's about the 40-page document about psychological associate for supervised practice. And when I initially looked at it, I'm in the MED stream, and I initially thought that simply by virtue of being in the MED stream, I could not register as a psych associate, but I do have a psychology undergrad, and it was an honors, so I have like the requisite courses. So I was just kind of wondering if you could speak a bit to, is it kind of quote unquote just on paper that if you don't have an MA, you can register with an MED? And I know I was talking with Lasha, I think, in your office.
Yeah, it's more complicated than that. The MA program here, as you know, is deliberately designed to meet the requirements that we have for registration as a psychological associate. If you have a completed MED, that will not meet the current requirements. But if you are in the process of getting your MED and can find a way, and that's really entirely up to your program, whether they will allow you to do it, to get those courses before you finish the MED, and if those show up on your transcript, that's what the college will look for.
So just having the requisite courses, like the same courses as the MA, right?
Yeah, but frankly, programs don't like to do that. And again, I won't speak for your program, but in general, programs are designed with a particular goal in mind. And so they devote resources and they select students for particular programs. And so in some institutions, we've certainly found that they don't permit students to take courses from other programs. Now, I don't know how things work here at OISE, and I won't presume to even say how things should work here at OISE, because programs have specific purposes and goals, and the program is designed to give someone preparation for certain types of careers and occupations. So, and it's certainly the MA is the one that's clearly designed to meet the college's registration requirements. And you'd have to really speak to folks in your program about, about that. But, that's the one that quite clearly matches what we have listed in our requirements.
Anyone else? Yes?
I don't know, it may be a bit vague, but you were mentioning, or I think to Catherine, you were mentioning that there is a requirement for, or not a requirement, but you look for almost like a continuum in the foundational knowledge.
An integrated sequence of studies.
That's right. So, as life might have it, some of the MED students may eventually develop an interest in something further and may want to pursue doctoral work and actually aim to be a psychologist. Does that mean that you would look at like a total regrouping from the master's and doctoral? Like who would I speak to about something like that? Like I would have my MED.
So you're saying you might want to get into an accredited doctoral program?
Right, but then I would have to sort of backpedal and have to sort of get, whatever I couldn't do it from an MED, so I understand that there's the backpedaling, so does the backpedaling take me out of the sequential category?
I'll let Dr. Cohen tell you about what it takes to get into an accredited doctoral program.
Many doctoral programs in psychology admit post-baccalaureate. Some more than others may actually have a discrete, you finish your master's degree and you formally apply to the doctorate. Others, that's not the case. You're admitted into the doctoral program post-baccalaureate. But there is a mechanism where they can give you some credit for the master's courses that you've accomplished, but that's totally up to the university to decide. So, one university's decision may be different than a different university decision, so it shouldn't theoretically mean that you can't apply for a doctoral program when you already have an MED, but there will be probably some variability in how much credit you'll get for what you've already accomplished at the master's level.
So you may end up essentially repeating doing some master's level
You may.
training.
It depends.
Joyce, you had mentioned that the Controlled Act was held by some other colleges as well. So, for example, someone who is a member of the College of Social Work, would they then not need to do the full 450? Is just being a member of the College of Social Work enough to call yourself a psychotherapist?
Well, Each of the other colleges whose members will be authorized to